Hello, and welcome to the GoLIVE Health Foundation Health Equity webinar series. Thank you to all the sponsors of the series. Today's episode is brought to you by our friends at NCQA. We would like to remind you that the Q&A feature is available, so feel free to send in your questions throughout the discussion. And with that, I will turn it over to our moderator who joins us from NCQA, Brian Buckley.
Hello and welcome to today's program featuring two amazing panelists who have started the process of building equity into their system through the NCQA Health Equity Accreditation process. My name is Dr. Brian Buckley. I use he, him pronouns. I'm the Director of Health Equity Initiatives at the National Committee for Quality Assurance, NCQA. I support NCQA's health equity strategy across the organization to better integrate health equity concepts into our internal and external programs, projects, and practices. I'll be your moderator for today's program. As a reminder that you heard before, this webinar is being recorded. As a reminder, please feel free, and I highly encourage you to use the Q&A feature that's at the bottom to ask your questions throughout the conversation. I will be seeing them, so please put your questions. I may not answer it right away, but we will try to get to it. I'll do my best to incorporate throughout the program, and also note I'll try to hold about 10 to 5 minutes near the end for Q&A if you need some time to gather your thoughts through the discussion. With that, I want to our two amazing panelists, Carrie Witcher and Leticia Barrett, to introduce themselves and their organization. Let's start with you there, Carrie.
Thanks so much, Brian, and such a pleasure to be with all of you here today. My name is Carrie Witcher. I am the Chief Quality Officer and Vice President of Quality Performance at UPMC Health Plan. I have over 25 years of experience in the quality improvement arena in a variety of payer and provider settings. My team specifically oversees all of our HEDIS submissions, our NCQA accreditations, quality analytics, member experience, and quality improvement across all of our lines of business, assuring continued success in all of our quality ratings programs. At UPMC Health Plan, we are the largest health insurer in Western Pennsylvania. We have over 4 million members and work very closely in collaboration with our parent company, the University of Pittsburgh Medical Center, which is a world-class academic medical center. We're very proud to share our 5-star quality ratings for CMS Medicare Star on both HMO and PPO products, 5-star rating on our NCQA commercial HMO, as well as our marketplace EPO. As I know my fellow quality improvement leaders appreciate, these results are indicative of our organization-wide commitment and innovative culture to pursue quality holistically and embed it in the center of everything we do. Thanks, Brian.
Thank you there, Carrie. Next, Leticia.
Hi, good morning or good afternoon. My name is Leticia Barrett. I'm Director over Accreditation and Quality for Health Net of California. I have been with Health Net for 14 years. I started in operations, moved to compliance, finally the quality improvement department with the Medicare Stars program and the CAHPS member experience survey. The accreditation health equity space is newer to me. I've been in it for about a year and a half. Lots of submissions since then, but it's been really rewarding, and I'm really excited to be here. My team oversees health plan accreditation, MHC distinction, which is obviously sunsetting, health equity accreditation. It also includes the culture and linguistics team, the health equity team, and the CAHPS member experience team. So I'm really pleased to be here, and thank you for the invitation, Brian.
Thank you, Leticia. As you can see, we have two awesome, amazing panelists that will be really diving into some of the work here. So before getting to our discussion and our amazing panelists, I thought it might be helpful to give some context to our audience on the NCQA Health Equity Accreditation and Health Equity Accreditation Plus programs, so you have an idea of the flavor of what they're going to be talking about. We at NCQA recognize that organizations may be in different places in their health equity journey. And that's okay. And I want to make sure that folks know that everyone is at a different spot. We are all going through this process together and co-learning together. Improving health equity requires engagement partnerships across the entire healthcare industry. And it can be tough work. And there are moments that it just feels super tough and feels like this immense big problem. And this is why we want you to ask those questions throughout this conversation and to learn from your peers and others that have gone through this process and the lessons learned. The NCQA Health Equity Accreditation and Health Equity Accreditation Plus are guides to help health systems, health plans, and other healthcare organizations advance health equity. I want to say that again, to advance health equity, because this requires action on all of our parts. Both programs support healthcare organizations into evaluating and elevating the health of the populations they serve. So just to give an overview real quick of our two programs, there's the Health Equity Accreditation Program, which used to be the Multicultural Healthcare Distinction Program, for those that are familiar with that. It focuses on the foundations of health equity work. And to summarize, it's really about how do we build our internal process so we can do the external work of health equity, because we know health equity, it starts with us internally, but that work is also out within the communities in partnerships with them. And how do we think about collecting our data to make sure that we're able to evaluate ourselves and make sure that we can offer language services and the services that our patients and communities need around cultural and linguistic needs and opportunities to address inequities and improve quality care. Our Plus program takes this one step further into this journey. As I said, a journey, and this is why it's the plus. We're going up here. It focuses on collecting that data and really understanding our communities, understanding what the social risk factors and the patient's social needs are, helping to organizations to offer what those resources they can do, but then also where are there opportunities to partner with community-based organizations and community leaders to help co-create solutions to improve the health and well-being of where people live, work, and play. And really building in that meaningful opportunity for patient and consumer engagement. And so we can think about social referral processes and partnerships and making them possible. So I am so excited to get into our discussion here with our speakers, Carrie and Leticia. So both of your organizations have been longtime consumers of the Health Equity Accreditation and also recently volunteered to pilot our new Plus program. So the first question I'm going to throw to you, Leticia, first, is tell us about what health equity accreditation programs accomplish for your organization.
Yeah, thanks, Brian. So we, as an organization, we've been committed to the MHC distinction for quite some time, over 10 years. So at our core, we were really focused on this work already. What was enticing about the Health Equity Accreditation Program was it really built upon that, right? It wasn't starting from scratch. It was utilizing what we already had built in place and making it better. And I think that the timing of this program really aligned with a lot of other changes happening, especially in California, right? With CalAIM, a lot of requirements in the Medi-Cal space. There was the work was happening, and now we had an opportunity to showcase it through health equity accreditation. And really, ultimately, it's about making that experience better for our members, right? So we're looking at it, we've been looking at it a certain way for so long, and then with these new standards, we have an opportunity to look at it differently and to expand it. Those are my thoughts, Brian.
Thank you. I'm going to shift the question now to Carrie on. Tell us why the Health Equity Accreditation Programs is accomplished within your organization.
Yeah, thank you so much, Brian. And my comments are similar to Leticia's in that, over the last decade, UPMC Health Plan has very much been at the forefront of the movement to help reduce health disparities in underserved communities, and improve health equity by addressing social determinants of health. And we've had some work in that decade to develop the Center for Social Impact at the UPMC Health Plan. And this is just a longstanding commitment and evidence to how we provide services and for those that are impacted by poverty. And so we've worked hard to align resources and aim to meet social needs that impact health, quality, and cost. On top of that, we're an integrated delivery and financing system. And so we're committed to reach urban and rural communities where health disparity is particularly pronounced. We've been intentional in launching housing activities to house homeless members, as well as spur investment in affordable housing. We have a Pathways to Work program that seeks to make UPMC a leader in workforce development and employment opportunities for our own Medicaid members, our members that have disabilities, as well as broader underserved communities. We also have done some human service integration work to aggregate data to improve coordination with state and county services, as well as coordinate with community-based organizations. And we've also been active in launching intellectual disability pilots that are really our best example of this work and have aimed to improve quality and support for members with intellectual disabilities and autism. So when we think about all of that foundational work, right, the health equity accreditation pilot was just one more ability for us to demonstrate our mission-driven commitment following these years of preparing for and achieving multicultural healthcare distinction, along with leading community-driven initiatives. The standards really helped provide a robust framework for the work that we were doing. Going through the process of accreditation has continued to promote extensive collaboration, top down, bottom up, and across our organization, as I like to say. We continue to build on strong stakeholder relationships that are both internal to the plan as well as external to our organization, really allowing us to influence collective efforts more holistically. So this accreditation process and program has allowed us to further embed health equity into our day-to-day work streams, optimize it as a critical component to our broader quality vision in our health plan, as well as our clinical improvement strategies, and has just further fueled bringing all of the right players to the table to advance our health equity strategy.
Thank you for that, Carrie. And so maybe even to both of your organizations, as I said, have been doing this work. You're committed to it. And so when the first opportunity, as NCQA had been thinking about this plus, what made you want to jump onto this pilot? And, because oftentimes, anytime people hear about pilot, it's like, what more do we need to do? So Carrie, I'm going to start with you, just reversing snake order here. What made you want to jump on this pilot as we were developing this?
Yeah, great question, Brian. Thanks. The opportunity to take advantage of any national pilot is worth considering. So having been in quality improvement for a while, you've got to stop and really think about what value something like this might bring to your organization and particularly your membership. And so this was actually at a very challenging time for us as we were in the process of completing our health plan accreditation survey when this opportunity arose. And so we were excited by the pilot to think about, wow, how could we further showcase all the great work we're doing? But then importantly, we also recognize, we have an opportunity, to your earlier point, Brian, to continue to learn. We have a lot, we're just getting started really, right? And thinking about how we continue to improve healthcare for those that have been historically underserved for many, many years. And how do we make sure we stay on the bleeding edge of this work in the industry? And so, considering this is the first time, at least in my quality improvement experience, that an NCQA pilot was linked to an outcome of accreditation, we heavily contemplated our readiness, if I'm completely honest. We really were hoping that our work would align with what NCQA would be expecting in this space. But I will tell you, the experience turned out to prove that our work is fully aligned, and the process further allowed us to work closely in a transparent manner with NCQA, as well as other health plans, to strategize on ways in which we could meet the intent of the standards. Also, when I think about a pilot opportunity, I think about where we can play a role in bringing value, where we can play a role in providing feedback to NCQA to think about, are you sure you really want to pursue this, considering where we are as an industry right now? Or maybe you want to amp this up a little bit more. And so being able to give that direct feedback to NCQA was also really worthwhile. So I would just say, in summary, we wanted to be a leading payer provider participant with this first group of health plans. And by the end of our discernment process, we knew we were ready. We knew we had it. We knew that we could provide important, meaningful input, and we knew that we'd learn something from it to continue to get better.
Thank you for that, Carrie. Leticia, same question on, especially for HealthNet. What made you want to jump on to this Plus program? Because, oftentimes, usually in my years of quality improvement, more work doesn't always seem like the thing people want to do. So what made you and your organization want to jump into this pilot program?
Yeah, thanks, Brian. I think jump is a strong word, if I'm being completely honest. So similar situation as Carrie. We had just submitted MHC distinction in September. We were also submitting our health plan accreditation in February. So there was a lot of resources already at their capacity. So we really needed to be thoughtful about jumping into it. We did a really quick assessment, right, to see what do we have, what will we need, and we escalated to leadership. And it was really important to us that we got their buy-in, that we would have the resources that we needed to be able to be successful, right? Because if we wanted to go, if we wanted to do it, we wanted to do it well. So it was very thoughtful. It aligned with our priorities as an organization. It was different than MHC, and I think that was what was exciting to my team, was that this thing that they had been committed to for so long was now being enhanced, right? So they could sort of hone in on some of the things they already knew the community needed, our members needed from a health disparity, health equity perspective, and now they could put, pen to paper to make it happen. And then I think the collaboration with NCQA was also, it was really valuable. And before my time, I know that my predecessor partnered with NCQA on the MHC distinction standards. And so to be able to participate on the Health Equity Accreditation Plus standards, it was really exciting. We were at the table with a lot of health plans. We helped identify areas of opportunity. It was really transparent discussion, and we thought of ways to do things differently internally. And that was really exciting too, because you get used to doing things a certain way, and then you hear, the Carries of the world doing things a different way, and you're like, hey, what if we applied it? What if we applied it to our organization? So it was very thoughtful. It wasn't something that we jumped into because we wanted to be successful. That was really important to us. But we had our leadership support. We had a team that was ready to go. And I think it was a very fulfilling experience.
Thank you for that. And I love hearing that this co-learning process and feedback loop, learning from the folks on the front line, but then also as NCQA learning what's important to us and how do we really move the health equity agenda forward. So something you both mentioned that I want to focus in on is, Carrie had mentioned, as a top-down, across everywhere approach. And Leticia, you also mentioned getting buy-in from leadership. And so we know often a lot of this work, unless you have leadership support, it can be very hard to get through. So what did it take to get your commitment from your leaders to participate in the Plus program and the Plus pilot as a whole? And we'll start with, I think, Carrie, we'll go with you here.
Sure, Brian. I am very fortunate to be a part of an organization that is not afraid of innovation. In fact, I like to often say we fly the plane while we're building the engine. And having already had achieved multicultural healthcare distinction, similar to Leticia, my team's confidence was there. This aligned with our broader quality vision. This aligned with our greater strategic goals as a health plan. And it was quickly recognized that, this is something that is important to do. It's important to pursue. There's a moral need to pursue such a level of accreditation. And with that comes a high degree of organization-wide support and collaboration from others. And we also had to be a little vulnerable in this as well. And that, again, to my earlier point, this was a pilot resulting in an accreditation outcome. There was no guarantee of success. And so it was important to understand that and communicate that in a vulnerable way, knowing we may not be successful. But at the end of the day, there was a strong recognition of the importance of this work and a willingness to take the necessary prudent risk to get it done. So I'm really grateful for being in an environment of that with that kind of expectation.
And Leticia, what was that experience like for you and your organization, your leaders?
Yeah, so similarly, I think that we're really fortunate that our leaders, from the very top, were already committed to this work. And I think one of the first emails that I got around the Health Equity Accreditation Plus pilot was from one of those leaders, like, hey, have you considered this? But that's not the only leader in the organization, right? So I would say that two things that I think were really valuable for us was that my direct leader, so the VP over quality, was really committed to this work, right? So all of the meetings that she was at with our CEO, our COO, she was talking about this. Our chief medical officer, she was talking about this. It wasn't a surprise, and there was that commitment at that highest level. The other thing is around socialization. So we have these standing meetings where we invite leaders, our business partners across the organization, and we brought it forward there so that there was, that exposure around the importance of this program. So I think those things align. There was the platform, there was the opportunity to present the importance of the Health Equity Accreditation Plus pilot, but also with all the work happening in California, with Medi-Cal requirements, with Cal-AIM, with just this, I think the pandemic really shone a light on the disparities, right? So there is a need to look at it. And I think that the timing of this was spot on because we were ready to go. We were ready to do more. So we didn't hit a lot of barriers, right? We did need to find the resources, but we didn't hit barriers in getting them.
And I love that we're going to talk about theirs, but I want to make sure I'm incorporating some of the audience questions into our conversation because I think it links very much with how we think about advancing equity. So I'll put the question out, and Leticia, Carrie, let me know who would like to go first in this one. Is, as we're talking about health equity, where do you see the role of incorporating community health workers into this work? And so I'll kind of pause with that. I don't know who would like to start with answering that.
Yeah, I can dive in first, Brian, to say that, that is something we continue to evaluate and more broadly support as it relates to thinking about how we optimize skill sets within our own teams, as well as more broadly within the community-based organization setting, to assure that we have the right resources supporting this work at the right places in the greater continuum of care, right? We want individuals to be able to work at the top of their license where a license is required, and where there isn't, how best do we understand and meet our members where they are in really honing in on key needs, social issues and risk factors that a community health worker is far better averse to address than perhaps another type of clinical professional. So I'm a big advocate of thinking about the clinical health worker in our greater, both our care management structures, as well as beyond that within community-based organizations where our members live and work every day. Those folks can really address their needs in a finite way that I think we need to continue to optimize.
Leticia, anything to add on to that question?
I don't, Brian. So we do have a team that's really dedicated to this kind of work. So I'll say that this is a bit outside of my scope and I don't want to misspeak. But what I do know in the few calls that I have participated in is that it really is collaborative. And as much as we can provide the support and the resources, we do step up and really try to understand what the support needs are and also what the outcomes need to be, right? And how do we get there? But I don't want to misspeak, so I will. I'll stop there. I think Carrie did a good job.
Thank you both. And I think just for the person that asked that question, I think even as we think about that plus pilot, as I mentioned earlier, it's about understanding our communities. And I think that understanding that new learning requires different skill sets and different people across the whole entire management structure. And people that have that lived experience understand those communities and can also translate that back. So hopefully that also adds to the context of that as well as we're thinking about accreditation process.
Mhm.
So going back to our questions, and for folks that are putting questions in, I'll be weaving them in throughout, but I want to make sure we also cover a couple core questions as well. Is you both mentioned challenges. This is not easy work, as I mentioned earlier, there's challenges around data collection, infrastructure, staff readiness. What were some of your biggest challenges through going through this process? And it could be both from the health equity accreditation process, but then also just advancing equity in the work that you do in your communities.
Mhm.
So I think I'll start with you, Leticia, on this one.
Sure. Yeah. So the few that stand out to me. So number one, you mentioned data collection, Brian. So I think that's a really important call out. I think the other thing that we need to keep in mind is that the organization has to have the IT infrastructure to be able to collect it, right? And to make sure that member preferences are included. That takes time to build, right? That does, and it takes a lot of finances to build as well. So I think that with this health equity accreditation pilot, there was a bit of flexibility for the organizations going through it because it was a pilot. So many of the things that are being developed are still in the implementation phase. They haven't been fully developed. And so we provided, a timeline of when we anticipate these things will be fully implemented. So the IT infrastructure, I think, is a big one. The other one is around documenting processes. So there's a lot of commitment throughout the organization to advancing health equity, minimizing health disparities. Almost every team has work in place. Is it documented, right? Because that is something that we need to submit as evidence to NCQA. And so, all those platforms I was speaking to before, the socialization of this work, a big part of it is make sure you are capturing the work that you are doing in documented processes, in policies, in your privacy materials, in materials that are going out to members, and making sure that it's clear across the board that all teams, even though anecdotally we are saying we are committed to health equity, that we are actually documenting that we are. And so I think that those were the two biggest challenges for us. So go ahead, Carrie.
Yeah, thank you. I'll just add to that to say that, transformation of any kind, and particularly as it relates to addressing health equity and related disparities, is that this is an ongoing evolution of effort, that it's going to continue to require organization-wide support and commitment, as well as continuous improvement, right? All the more reason for NCQA to be thinking about this and our quality teams to be acting on it. And so similar, we work to translate the ongoing work of our cross-functional teams, again, across our organization, supporting this accreditation model to, again, connect current process to the standards, and to Leticia's point, assuring the necessary documented processes exist. We have the right reporting, policies, etc. Were in place for hardcore evidence. Our health plan has dynamic programming, and so and certainly the drive and vision, if you haven't picked up on that already, to reduce health disparities. But this process really challenged us to do it in a way where we could attribute this to real outcome, and to assure that we had the right processes, policies, and reports in place, and that we continue to advance them as we move forward. I think another big challenge just in the pilot process alone was the limited time frame to prepare. And again, requiring that strong organization-wide teamwork, building a strong collaborative team of subject matter experts were required. And so rallying, experts across quality in our clinical care management areas, our network areas, human resources, product leadership, legal, compliance, and so many others, are really what allowed us to overcome this challenge. And, we also took full advantage of the weekly meetings with NCQA and with the other health plans, so that as we were moving along in addressing these challenges, that we had an opportunity to ask questions, problem solve, transparently brainstorm ideas in a safe place, and figure out how we can move forward on this together.
And if I could add one thing, Brian, just a tip is to prioritize the things that take longer to implement, right? I know that that seems obvious, but there are some areas that do take more time. So I'll give you an example: the privacy materials, right? There is so much embedded in that. Prioritize those, right? If you know it'll take longer to implement, connect with those teams first. Same with the IT component, right? Building those IT enhancements, that takes time. So when you're going through your assessment, flag those areas that will take more resources, will take longer to implement, and sort of start there.
All very great. Well, one, thank you for being transparent about those challenges, because often that's also part of the work of health equity, knowing where there are challenges and where we need more new learning, and building in that growth mindset. So going back, shifting gears to some of our questions from the audience, because I'm trying to incorporate them in different ways. I think for both of you, you both had talked about amazing work that your organizations are doing to improving access to clinical services. And so if one or both of you could answer the question on what are some examples that your organization is doing to increase access to clinical services and care, because we know that's one part of health equity. How do we increase that access?
I will go first, Brian. So let me level set that I'm not a clinician. So my point of view will really be from an operational level. One area that I think is really important to look at when you're talking about access to care is those internal operations, those internal barriers. So for organizations that are complex, the referral and the prior authorization process, right? For a delegated model, what does that look like for the members? And then overlaying the membership demographics, so you're really getting to the core, right? So looking at race and ethnicity and language barriers for appeals, for prior auth, for authorizations. The other thing that I think is valuable and something that we will be deploying in the next few months here is we have an existing quality committee. We are starting to overlay health equity at that committee. So all of operations that is presenting at that committee, that is presented up to the board of directors, will overlay this race, ethnicity, language, barriers into their analysis, right? So their appeals analysis, their access analysis, and we will be getting external provider feedback. They sit at those committees. So they'll be providing their feedback, the challenges that they're facing with our organization, and also what they're seeing in the community. So that is a non-clinician area of opportunity, something that I have tried to do in my work. And I think that what's special about my team is that we look at it from a health equity standpoint. We also look at it from a CAPS member experience standpoint, right? So it's all about the voice of the member. And there's so much data that we have in-house. How do we use it to make it better and really understand it?
Yeah, I can certainly build on that too, to share that I too am not a clinician, but have certainly worked many years with clinicians and have had the opportunity to be engaged in the care management space. And so there absolutely is a role for our broader provider organizations to play in this health equity work, right? As it relates to how we drive partnerships and related value-based programming to assure the consistent delivery of culturally sensitive care, that we look to fill the gaps that inhibit access for patients at the start of their health journey, such as getting them to appointments, right? And how we address some of those social determinants around transportation in particular. And that we think about, who is the best entity to provide those clinical services, right? To make sure that they're connecting to the right degree of support, that they experience a sense of trust with their provider or with a community-based organization that can help advance their healthcare. And so, thinking about all of the options that exist for our members and partnering with external entities, providers being one, but also, as I alluded earlier, to community-based organizations who are deep in the communities with which our members live, right? Meet them where they are and leverage the wide range of resources that are available today and help them navigate that, connect them, make the referrals, follow up, right? All of those things that are a part of these standards, I think are really critical for us to act on and continue to drive improvement around.
Thank you both. And I think one question that's popping up in my mind that actually might relate to one of our audience questions, and going back to some of the challenges, I think it was you, Leticia, that talked about, it is really about socializing this from an operations perspective, because we all remember that one quote: every system is perfectly designed to get the results it gets. And as we think about health equity, it's reimagining the system of how we operate. And so I'm a huge Marvel, DC fan and comic book. So I think of this like the Avengers or the Justice League. There are different people within your organization that you are trying to combine and do this work together. Can you speak to what was the work that you, or the lessons learned that you had on, one, socializing the idea of health equity as a team sport, and or keeping that sustainability and keeping it going? Don't know who would like to start.
I'll start, Brian. Oh, do you want to go ahead, Carrie?
No, go ahead.
So I alluded to this earlier, Brian. I think that the timing was right. So, in addition to having leadership being committed to this work, we also have a chief equity officer that was recently placed in this position, right? So I think that having her at all of these leadership meetings at the quality committee, she will be a co-chair for our quality committees, which will be deploying in a few months, or being enhanced in a few months. That keeps it connected, right? So she is now at the table with operations in this role. And so we had this commitment to health equity, at our core. Again, I mean, we've had MHC distinction for so long, but now having this lead over health equity, being plugged into all the operational meetings, to all the committees, to the CAC, to our quality committee, it keeps it really aligned. And she has a very large role in it. So she's not a participant, she is a co-chair, right? So she is helping to see where there are areas of opportunity to enhance, where there are gaps, where we are not looking at health equity and should start looking at health equity. So, again, I think that there's a lot changing in this space. There's a lot of regulatory requirements. There's the NCQA requirements, and we have built a structure to ensure we're successful with our leaders. So it's coming from the top.
Yep. I very much resonate with those comments. We often reiterate across our health plan and leadership the criticality of structure, which drives process, which then drives outcome. And again, having strong cross-functional quality committees established by which our senior most leaders are fully engaged, our board, our quality committee of the board being engaged in the work and hearing the input, tying goals around to this work deep into our organization is critical, and assuring ongoing dialogue through we're users of Plan, Do, Study, Act. And so we think about work groups that can continue to launch in a way that aligns our clinical, quality, product, and network resources in one place to keep this work front and center, and to continue to drive coordinated effort to make improvements is also really important. So, I think for those of us as quality improvement professionals on this call, we can all agree that quality improvement is no longer about our quality department anymore. This work takes a village. This work assures the right leadership and the right diverse team commitment to chart a new path. And we're working to do just that as we move forward. And to my earlier point, to keep learning along the way.
Thank you
And I
both.
think one thing I'll add, Brian, if that's okay, because we talk about structure and how important that is, right? Those very formal structures. Having those informal structures are also really important. So we have a few just work groups where we invite whoever wants to come, right? And we have operations, we have quality improvement, we have the community engagement team, and we just talk about the issues. And sometimes we have a presentation, right? A focus update. And sometimes we're just saying, what should our priorities be? Let's look at the data, right? What do we have the resources for? Who do we need to escalate to? And that dialogue, that brainstorming, I think is really valuable, right? And then you take that to the more, formal structure. So, I did want to share that I think that's been really valuable for us as well, to sort of hone in on where the areas of opportunity are and where we're really committed to what we're committed to prioritizing. It doesn't mean we won't get to all of it, but what are we going to do first?
That is amazing. And I like the fact that you did bring in the fact of informal structures also being a very important piece in this work. And so as we're getting closer to our end, I want to make sure folks remember to kind of make sure you're littering the Q&A with different questions, and I'll try to make sure I incorporate some of them where they fit in really well. And so one question that I have, as you've gone through this process, I mentioned earlier that everyone is at different parts of the journey of health equity, and some people find some of the challenges you guys have even mentioned somewhat daunting sometimes. What's some wisdom or lessons learned that you would share with organizations who are starting this process of transformation, both at the very beginning and those that are a little bit further ahead and find some of this work just overwhelming? And so
I'll jump
start
in
with you there. Yeah, there.
Yeah, sure. Thanks, Brian. It's very important to assure broader commitment, right, from your entire organization, that there's alignment with greater strategic goals, and that those conversations happen. And again, sometimes goes without saying, but that they happen early in the process. Prior to jumping in with both feet and making your own decision as to this being the right thing to do, which of course it is, but making sure you've got a team behind you rallying for you and removing barriers along the way has been critical for us. Continuing to educate, continue to have that open, honest conversation as to what is working and what are our real challenges, and how do we then take the appropriate next best action to mitigate that moving forward. Teamwork, I think, has come out multiple times to be really cognizant of the fact that there are some training needs that exist within our organizations around the concept of health equity. There's system upgrade needs, as IT has already come up before. There's a need to continue to enhance current process. And this all takes extensive, committed time while people are continuing to engage our members day to day, as we have all been doing for many years in a member-centric way, right? This is needs to be embedded, to my earlier point, into our ongoing work. I think it's also very important to recognize that no matter where you are in the journey, there is always room to grow and improve. There will always be gaps. And as with any challenge, right, this is a huge opportunity to improve the health of our most vulnerable members and patients. And we've got to start somewhere. And so it's just so important to be willing to have those bold, courageous conversations across your organization and really push for the innovation and action that's required. And then, I'll close out in sharing wisdom here by saying that it's so important to remember the why of this work, and intentionally work to go beyond the what of it, right? There's a lot of tactical things that we need to get lined up to submitted evidence, but why are we doing this, right? We're doing it for the benefit of those that we're passionately serving each and every day, and recognizing this is hard work, but it's our obligation as mission-driven organizations to advance how we can directly benefit our members who have experienced systemic challenges to achieving health over many, many years. And so we're not going to fix it overnight, but getting accreditation and thinking about our processes and systems, people, process, technology, as we often like to say, is a step in that direction to make real progress and begin to unravel the numerous disparities that exist in our world. And I think it's critical that we continue to work alongside our communities, let them lead, hear from them, right? Learn and listen. They're the experts and what they want, what they need, and often how to deliver those successful interventions that meet our members' needs where they are in their health journey. And so I get passionate about that, and I my apologies for that, but it's something that I very much am committed to, of course, as a chief quality officer here, but also what it really roots us and grounds us in why we get up every morning and come to work. So we're passionate about it.
Leticia.
Thanks, Carrie. Yeah, I have a very similar response. So it's twofold. So I think that the first thing I'll say from sort of an accreditation standpoint is get organized, right? Really understand what's being asked. Get it all in a spreadsheet, have a work group to understand each of the standards, and then tell the story. It's very likely that within your organization, you have some of this material, some of these documents already embedded in your day-to-day that you are maybe not familiar with, or you just haven't had a chance to look at it through this lens. So get really organized and plot it all out. And then you pull in the right people, right? So you socialize it with the right leaders. I think it's really important to get your own leaders' commitment, right? So they can bring it forward to their leaders, and then just socialize it across the organization. I mentioned we have a biweekly ongoing audit readiness committee is what we call it. And we bring these things there, right? There's, over 50 attendees sometimes. So, you bring your assessment in front of those that will be doing the work. So it's not a surprise. But first you want to get really, really organized and understand what's being asked. I think the other thing that, and Carrie touched upon this, right, is the education standpoint, right? Why is health equity so important, right? So there is an accreditation standpoint, but there's also a culture shift, an organizational readiness that needs to be made to understand why are we treating our members this way? How can we change? What needs to be different? How do we improve, and why is it important? And so just making sure the training is there, the resources are there, that is not something that can be done overnight, right? It's something that you need to start having that dialogue with your leaders about the importance. If you notice a gap in a certain department or a certain area, why is that, right? How do we make it better? Do we have resources out on our website? Can we do annual trainings? Can we do quarterly trainings? Can we bring a panel in to talk and have those courageous conversations, to have those just transparent discussions? So it's twofold. You have to accomplish the work. You have to really understand the standards and understand your own company's limitations, those technical limitations or, resource limitations. And then also, why are we doing this work? Why is it important? So those are my thoughts.
Thank you so much. I think what I heard right there was amazing. I think I couldn't have asked anything better. Really, that why, that sensitivity to operations, and really living your mission and vision for your organization, living those values. So thank you so much for both of you for sharing. As promised, I said I was going to try to get 5 minutes of questions in from some folks, and I see there are a couple of questions, and I'll try to summarize some of these questions into how it links with accreditation. So one of the questions I'm seeing here is, and I think you both have talked to this, the accreditation is a framework in which to build this advancing health equity strategy. But what are other measures that you look to for success outside of the Accreditation Plus program? And whoever would like to start.
So there are numerous measures of success that come to mind, Brian. So if there's, I'm not sure I'll take this down the path where you're looking, but at the end of the day, we are thinking about how we continue to sustain and optimize our overall quality ratings, by which NCQA, CMS, our state Department of Health and Human Services holds us accountable. And so it's very important that we're addressing deep-rooted issues for our members to assure that they have optimal access, high quality, low cost care. And at the end of the day, it's my opinion, our quality ratings are often that greatest measure of success to knowing if we effectively delivered on that. And so when we think about all of the ways in which we're held accountable as health plans, right, we also have a great obligation to assure that we're looking at our standard quality measures in a way that is sliced with a race ethnicity lens, that we're going deep into our data to understand where we're focusing within our communities of greatest disparity, where we start, right, and make sure that we're assessing what that performance looks like at that race ethnicity level. And so that is really important for us, I think, as we continue to optimize gap closure, to optimize the member experience, that we're continuing to look at our data in new and different ways, so that we can ultimately execute on the 5-star performance that we're lucky to have today.
Leticia, anything to add to that?
Yeah, so in addition to the quality rating, which I completely agree with Carrie about, and we do look at our clinical measures from a race ethnicity standpoint. We have a brilliant team of analysts that have put together a disparity dashboard. So ideally, when you put a project in place, right, what are the outcomes? What are the goals? How much do you want to see the disparity decline, right? So really setting that up front, I think, is important. And then, you know, having the tools to dig into it. So I think she's absolutely right. Our quality rating programs are really important. The other thing I will say is look at your cultural linguistics grievances, right? Ideally, you would want to see those decrease, right? What are the interventions like? Are they declining year over year? If there's an increase, what's causing that? Is there more training needed for providers? Is it internal? Is it an interpreter situation? So those kinds of things I think are really good indicators of the member's experience with cultural linguistics issues, provider respect issues, disparity issues, health equity.
Mm-hmm.
I love that you brought the grievance piece in. One of the members of our NCQA team actually had been in that space and actually mentioned like that is another indicator of things that people are always thinking about. Are we making sure and understanding and seeing what's the song beneath the words of that grievance and making sure that we're creating an equitable environment for the folks that we serve? The last question before we end, and this hopefully, we both have mentioned the fact that it is a multi-transdisciplinary team that's really doing this work. And so one of the panelists or the audience had asked the question of, for community-based organizations that are interested in partnering with institutions like you, who are the people that they should be talking to help start building this partnership and collaboration?
Mm-hmm. Mm-hmm.
Any advice for them?
Yeah, I think the one thing that comes to my mind immediately is our community engagement team, right? We're fortunate to have our Center for Social Impact, which I referenced earlier in the conversation, that those that are connected closest to our communities have an understanding of needs and are leading initiatives within our health plan to support those communities is a great place to start. You know, I also think about our networking teams, whereby, you know, we've in the state of Pennsylvania are required to work with our CBOs in a value-based payment arrangement type of way. And so we've also got ongoing dialogue happening between our network teams and community-based organizations. And then, you know, third, I would add, you know, we all kind of have our hands in this pot to the point of the question, right, Brian? From a clinical perspective, right? We have clinical leadership and others that are very close to designing the deep, you know, programmatic approaches for our members. And so those two are great resources, particularly as we work on the referral side of things, where our clinical folks are on the front line of this work, and it can absolutely be a great point of contact to discuss further collaboration.
Yeah, and so I agree. I think the community engagement team, I would also say quality. I think that is a good team too to start, right? Your chief medical officer, your VP over quality. The other thing I'll say, in addition to what Carrie said, because I think what's really important is that you look at your structure. Do all teams understand the importance of building these relationships, right? So going back to that training component, that understanding, essentially, if there's a community-based organization that wants to connect, if they reach out to anyone, any leader, that organization should hopefully be able to point them in the right direction. Yes, this is something we want to build. This is a relationship we want to create. Let me connect you with X, Y, and Z, right? So really also looking into your internal structure, is everyone aware and fully understand the importance of this work, the importance of these connections, the importance of the community and the members that we serve? I wanted to add to that.
Thank you. I think that speaks volumes on, if no one can answer the question within your organization, going back to a further question on measures of success, that is another measure of success, that everyone knows where the organization is moving and who to point to when it comes to working on equity work. So that's all the questions we have. I know I wasn't able to answer all the questions that folks had put in the chat, but for the folks that did, I did submit questions, thank you. And I like to close off with quotes all the time. So my closing quote for this is, not everything that is faced can be changed, but nothing can be changed until it is faced, by James Baldwin. And I think that speaks to the work that we have to do in health equity to really face a lot of these big issues that we see in front of us. So I just want to say thank you to Carrie and Leticia for joining us today and being just health equity champions, your organizations being health equity champions. And thank you to the health team for hosting this conversation. And thank everyone for joining today that's listening live and also listening to this recording. And we look forward to further conversations in the future on seeing how we can improve the health and well-being of where people live, work, and play nationwide. Thank you.
Thank you.
Thank you so much.
Thank you to Brian and all of our speakers. Please visit our website at hlth.com to catch up on all Health Go Live webinars. And join us in Las Vegas, November 13th through 16th for Health 2022.